Today I've got Joe, and he has come in with some severe low back pain after hurting his back doing deadlifts at the gym. We've done a little bit of testing and we've sort of diagnosed this as a lumbar disc bulge. So today we're going to be treating it just with dry needling because he's so acute that we can't actually move him around too much to do the soft tissue work, and that might actually aggravate his symptoms. So we're just going to do 3 different positions and try to decrease all the muscle spasm that he's got associated with that disc bulge. So what we've got first of all is we're going to target the QL muscle. This is the main culprit that sort of locks down in lumbar disc injuries, and it runs from the ribs down and around to the pelvis like that, and it'll sort of compress and create a lot of pain. So I like to do a couple of needles in each side to start with for this. And how's that feeling, Joe? That all right?
It's not bad.
Not too bad? Yeah, great. So the great thing with dry needling for disc injuries is that by just putting the needles in, we're not having to move the patient at all, but the needle itself, the body recognizes it as a foreign object and goes, hey, we need to get rid of that. So it draws a lot of blood flow to the area. But with that comes oxygen to those tissues, which will decrease the muscle spasm. Oh, you can really feel that was freaking tight. Great. After we sort of target the QL on each side, the other muscle that will lock down are the lumbar erectors running down here. So we're going to get 4 needles into there, and we even got a little twitch through that. How'd that feel?
That's all right.
Yeah, cool.
I felt it.
You knew about it? All right. So these ones will be the ones that when they lock down, they prevent any lumbar flexion. So you'll be really, really having trouble bending down, touching your toes. But it'll also cause, as you come back up, if they're so seized up, they're not actually able to contract properly, and you'll feel weak when standing back from that bent over position back to neutral. So the next tissue we want to target is not actually one of the muscles, but a ligament. So from the edge of the pelvis here to where it connects to the spine, we've got the iliolumbar ligament, and this can really affect the SI joint, which sort of, gets jammed up when all those muscles spasm the way they have with Joe here. Good. And then next we go into each of the glute medius muscles. And one on the other side here as well. And then once they're all in, we just let that sit, draw the blood flow to the area, help those tissues relax down for about 5 minutes. But Joe's been also getting a little bit of leg pain, mainly just radiating down to here, which is actually not too bad. Pains for leg pain is bad when we get it down past the knee into like the foot and the calf. That's usually a sign of sciatic pain. But if it's up here, we're thinking more of a trigger point referral from either the TFL or the glutes. So we're going to treat those next. Joe, if you want to lay on your side facing away from me. How's that feeling? Still a little tender?
Tender, but it feels a bit better.
Yeah, good. All right, give you a little pillow there. And then let's get stuck in to those muscles in the side of the hip there. So like I was saying, we're going to hit the TFL through here, and again, a bit more of that glute medius, glute minimus through there as well. I think this is going to give you a lot of relief for those leg symptoms that you've been getting. Good. That one felt pretty junky.
Yeah, that one hurt.
Yeah. Is that reproducing that pain in your leg now? So that's what we're looking for.
Yeah, I'm getting that down there.
How far down is that radiating?
Just to the knee.
Right. That's perfect. So what we want is to reproduce those symptoms. That means we're on the mark, and that as that blood supply goes to that point, you'll feel it coming back up as well.
Yeah.
So again, let's let that sit there for a moment. So the next muscle we need to target is actually the hip flexor. So the three major muscles that will seize up in any disc injury: hip flexor, glutes, QL. So to hit the hip flexor, we take it at this attachment point just here. And that one's not as comfortable, hey Joe?
No, that's not nice.
And we know that his TFL was pretty angry, so we're going to hit the lower portion of it here as well. And we'll hit the hip flexor for both sides, because this one is really effective. Even though you think, yeah, it's the front of the hip, it actually goes from the hip through the guts and attaches to the spine. So when that seizes up, it pulls your spine into like a position like that, which puts more pressure on those discs again. Hit this TFL. So now that we've sort of got all those needles into Joe, the next steps for him will be to peel back from any heavy compound lifts at the gym, but also some home exercises to mobilize the disc and get that healing a lot quicker. The best thing for that, if you're suffering a disc injury, is actually to do Mackenzie extension. So laying on the ground, slowly arching up. If you can only get halfway, that's okay. And you just sort of work in that range, and you'll find over time, you'll create more range of motion, which takes a ton of pressure off the disc. But Joe's only just started this journey with us. So from this, we'll then, next week get him in for some soft tissue work. And then we'd look at what actually led to this injury. Why did his core fail or the hip control fail? And we'd start working on core and hip stability to make sure this doesn't happen again for him. But what I'm going to do, if you've enjoyed this, I'm going to link a video that has all the soft tissue work for a CrossFit athlete, and I'll show you that end of things too. But I'll see you next time, guys.